Assalamualaikum and hi everyone. We are students from UiTM Perak branch Tapah campus. We'll present about COVID-19, the killer in silence. This is our group members. We are Nur Aishahana, Maisarah, Natasha Aina, Nasnisha Neili and Putri Raihana. Do you know what is this? This is SARS-CoV-2. It belongs to the family of coronaviruses. SARS-CoV-2 can cause COVID-19, which is a contagious viral infection that attacks primarily our throat and lungs. What is COVID-19? COVID-19 stands for Coronavirus Disease of 2019. It was unknown before the outbreak began in Wuhan, China in December 2019, but it was declared as a pandemic by WHO on 11 March 2020. The infection spread really fast to other countries including our country, Malaysia. It spreads through person-to-person contact, which is highly contagious disease, and it still has no vaccines until now. So how can it spread in someone's body? It starts with droplets from an infected person's cough or breath, and it will give virus a passage to mucous membranes in our throat. The virus moves down our respiratory tract, and our lungs might become inflamed, making it tough to breathe, which leads to pneumonia. It crawls along the nervous system, destroying the taste and smell, and within 2 to 14 days, immune system may respond with some symptoms. The symptoms of this disease is fever, cough, shortness of breath, headache, and loss of taste and smell.
Prevention. What we have to do to keep us safe from COVID-19. As we should know, the diameter of the coronavirus is estimated to be 125 nanometers. Social distancing is one of the best solutions to keep ourselves safe. So, what is social distancing? It is also called physical distancing, which means keeping a safe space between yourself and other people who are not from your household. Next, to practice social distancing, we must stay at least 3 feet, which is about 1 meter length, from other people. Social distancing should be practiced in combination with other everyday preventative actions to reduce the spread of COVID-19. It is including wearing masks, avoiding touching your face with unwashed hands, and frequently washing your hands with soap and water for at least 20 seconds. So, next, why do we have to practice social distancing? It is because COVID-19 spreads mainly among people who are in close contact for a prolonged period. Social distancing is especially important for people who are at higher risk for severe illness from COVID-19. It also helps to limit opportunities to come in contact with contaminated surfaces and infected people outside the home. This is how we must keep our distance with others. Wearing face masks are also one of the ways to stop the virus from attack our body system. It will help prevent the spread of infection and prevent the individual from contracting any airborne infectious germs. Wearing face masks is one of the simple ways to help decrease coronavirus transmission and can save many lives. The importance of using face coverings in public is illustrated in the graphic seen here. In this graphic, transmission probability is high when both COVID-19 carrier and healthy person are not wearing masks. When COVID-19 carrier wearing mask, transmission probability is low to the healthy person without mask, and transmission probability is the lowest when both COVID-19 carrier and healthy person are wearing mask. There are many types of face mask. Number 1, fabric or cloth mask. Number 2, surgical mask. Number 3, N95 mask. And lastly, face mask with valves. The best mask that we can use is N95 mask because it can filter 95% of particles that are 100 to 300 nanometer in size, and fabric mask is the most less effective mask than the other.
Next, we are going to talk about hand sanitizer and wash hands. These are the important way to prevent ourselves from get infection virus COVID-19. This is important when we have to go outside for a work and the gym is everywhere. Besides, it cannot be seen, it's invisible. So, using hand sanitizer or wash hand frequently can protect ourselves from get infection at open environment. So, actually, hand sanitizer, it will kill germ. It can kill the germ at our hand from spreading all over the place, and also it can come in two texture, whether in gel or liquid. Hand sanitizer also the effective way if water and soap are not available. Next point is use sanitizer that contain at least 60% alcohol, which is known as isopropyl. How to use hand sanitizer? This is the way to use hand sanitizer, which is first step is take hand sanitizer that contain 60% alcohol. Apply it enough at your hand. Rub it at your fingers, palm to palm, fingernails. So rub it for your both wrists, thumb to thumb, for about 25 seconds or until it dry, and that's how to use hand sanitizer. However, using hand sanitizer is not well enough compared to wash hand. Wash hand also same function as hand sanitizer, which is kill germs, but this time using soap and water. This is the most effective way compared to hand sanitizer. Why? Because soap is detergent. Detergent has bubbles, so it can kill all the germs at our hand. Also, it is easy dissolve in water and oil, so it can wash all the germs or microbes off from our hand. To stop germs spreading everywhere at our hand, we should wash our hand frequently.
Why should I avoid crowded places? When I say crowded places, it means many people. When it is many people, it becomes a high-risk area. When we are in a crowded, it is very difficult to track who we might interact with, where they are from before this, and who might be the virus carrier. Coronavirus spread like other viruses, which is via droplet that excreted by coughing and sneezing. Transmission can occur from people to people by physical contact and even if we contact with contaminated surface. This is why we should avoid crowded places. Best way to stop the chain is to stay at home and only go out when needed. As the coronavirus pandemic rapidly sweeps across the world, it is inducing an impressive level of dread, worry, and concern in the population everywhere and among certain groups in particular, such as elderly, care providers, and people with underlying health conditions. Did you aware that while we are in quarantine phase, many people's usual activities and routine were affected? Most people that live alone at home in a long period of time will find themselves very lonely. Some people were also diagnosed with depression because their life changed 360 degrees from their normal life. Constantly listening to media coverage about coronavirus can make a person more stressed and anxiety. And it can also lead subconscious mind to self-hurt. With the global stock market fell, many people lost their job and source of income. For some people who given up, think that suicidal behavior is the only option they have due to overstress.
Next, the effect from COVID-19 is the increase of number people of death. Death caused by COVID-19. The number of deaths that have been recorded up to today is 240. 68.7% of deaths recorded comprises of those ranging from 50 years old and above. Also, the causes is by older adults at higher risk for severe illness from COVID-19. Older adults also have a low immune system to protect their body from get infection. For those who have cardiovascular disease, also has a high risk of death in case of infected by COVID-19. The death cost from those who have chronic respiratory illness known as pulmonary disease like asthma and lung disease is easy to get infection from COVID-19. Lastly, to prevent the deaths to increase, people who have health issues are advised to stay at home and avoid crowded places to reduce the risk of infection.
The implementation of the 14 Days of Movement Control Order (MCO) to deal with the spread of COVID-19 affects the national economy. Firstly, the impact on economy is petroleum. The performance of the world crude oil petroleum market declined below $30 a barrel is the worst in 80 years of global market. It affects our national economy because Malaysia is one of the world's oil exporters. Next, the government estimates total losses in the tourism sector from January until February 2020 by RM 3.37 billion. According to the Prime Minister Tan Sri Muhyiddin Yassin, the spread of COVID-19 will cause the travel package to be cancelled and affect those working with airlines and hospitality. According to the Ministry of Tourism, Arts and Culture, the campaign of Visit Malaysia 2020 has cancelled caused by the spread of COVID-19 in 140 countries around the world. At the same time, the global stock exchange market is experiencing a difficult situation and a downturn due to COVID-19 pandemic concern. Securities Commission Malaysia and Bursa Malaysia Berhad announced short selling suspended temporarily until 30th of April 2020. This reliance was introduced as part of proactive action to reduce the potential risk arising from the intense uncertainty of global market. New normal era including education field also affected due to COVID-19. Online distance learning is the new normal era that focuses on home learning. The impact on students are they don't understand what is being taught during online classes and they don't complete the assignment given. The teachers have no experience conducting online learning, so they're struggling to make sure the students understand what the teachers teach. Since the students are home learning, they require device equipment. There are 900,000 school students. Only 6% students have computer, 5.76% have tablet, 9% have laptop, and 46% have smartphone. And the rest are 36.93% students does not have device equipment. It means that 3,400,000 students does not have device equipment. They need device equipment so that they will continue to study at home.